Suicide is indeed increasing in the United States. The rate of suicide has been increasing for the past 15 years. And over 40,000 people fall victim to suicide each year in the United States. So it's a huge problem. It's a problem that we ought to be able to do better at. And in fact, other countries, other developed countries, the rates of suicide are steady or decreasing. So we stand out in our inability to stem the tide of increased suicide. So we don't understand why our rates are going up. We don't understand why other countries are going down. There are some hints. There are bigger investments in some countries in providing mental health care more universally and providing greater access to care. That's one hint. Another hint is if you look at the map, we see the greatest increases in the rural areas where there is less access to mental health care. In the area of suicide prevention, research funded by NIMH has shown that you need to ask people whether they're thinking about hurting themselves or killing themselves, whether they might be depressed. And you need to do it all the time, whenever a doctor sees a patient, at least for the first time, because most people who are suffering from suicidal thoughts won't volunteer them. But what we've also shown is that when you ask, you can actually make a difference in suicide risk. You can lower an individual's suicide risk in pretty simple, straightforward ways. A study that we just funded looked at individuals who presented to emergency rooms for any problem. And when asked about suicide, about 6% of those people acknowledged suicidal thoughts. Moreover, when offered referrals, and when those referrals were followed up with phone calls home over the next year, very simple intervention, very inexpensive intervention, the rates of subsequent suicide attempts in those individuals dropped by about 15–20%. So one can make a difference, actually, a big difference, in suicide risk with relatively simple interventions. So that's an exciting development that we're continuing to follow up on.